Welcome everyone, ADV Amandha Vollmer here, and my friend Linda Salter, RMT, and brilliant expertise to present to you, some really important information about our bodies and bodily mechanics, because we talk a lot about physiology and biochemistry and what we eat and our lifestyle factors and all these things. And oftentimes we forget our body, our mechanics, how we sit, what we're doing to ourselves on a daily basis, our habits, our sleep habits, the way we manage our stress in our bodies, where we carry it in our bodies. And also we tend to neglect the body quite a bit, and that can lead to all kinds of syndromes and symptoms. And then people go to the doctor and they're looking for a problem when they're missing really important information about our body. And, you'll get all kinds of different opinions on what those symptoms are and how they're presenting the mind situation. But, we can come at it from multiple angles to solve it. And yes, the diet's important. Yes, the stress management's important. Yes, the sleep's important, all these things. But what's really important is ensuring you're not neglecting other aspects of your health. And we're gonna talk about an invention that she came up with to help balance the spine through the hips, and also about the central cord that you call the line cord, which I will ask you about, which can be pulled in different places and cause a pulling on the brainstem, which can lead to all sorts of disease states that we are familiar with their terms, but we don't really understand the root cause, which is what I'm all about personally, making it easier, getting to root cause, solving the issue without so much complication, and then really getting the body into high form with really optimal nutrition and good, hygiene in general, spiritual and nutritional and natural hygiene. So welcome, Linda. Thank you for teaching us about this today. And I do know, you've been in RMT for, you said 20 years. When we talked and we actually met, which was great, she came here and gave us a treatment and showed us what you do and how you do it. And it's really intriguing and it's really important. And this is one reason why we're doing this video today, to get the word out, help people get out of pain. So why don't you give us a little bit of background about how, you went a little bit through school and what your experiences were, and then where you're kind of at now, 20 years out.
Yes, it's been a long time. Well, thank you for having me. This is a great opportunity. I love talking to people about this stuff. I've been doing this for about 20 years. I started off, I went to school in Quebec and I practiced there for a little bit. And then I happened to move out to BC and I worked there for a while, and then came back here, went back to school a second time about 10 years ago to be registered here in Ontario. What I've been practicing for about 20 years. I have a big sports background too. I did a lot of basketball and I was a swimmer. I've also done I was a trainer for a football team here in Cornwall, Ontario for a few years, and I've touched a lot of people. Let's say in 20 years, I've touched a lot of people, and I'm always trying to think outside of the box. I really care about what I do, very passionate. That's what my clients will tell me, because I'll come in on a Sunday because I don't like to see people in pain, and I see way too many people in pain. They go to doctors, and doctors are great for a lot of things, but sometimes the musculoskeletal system they're not so good at, unless you want anti-inflammatories or some pain meds. And there's a lot of new information out there, new neuro information out there that's really great that I have learned. I think I've learned more in the last 2 years since my invention, Butt-thotics, which is a shim that you sit on, because a lot of people are sitting nowadays. And it all started with one of my clients who we were shut down for 3 months during the beginning of COVID. And she was a 35-year-old seeing me every month for I don't know how many years. She couldn't see me for 3 months, and she ended up going to the doctor for pills, which was the first time. So she sits at a desk all day, doesn't do enough exercise. So one day, instead of evaluating, because I do postural assessment when you come in with something, I'll look at you, I'll watch you walking in. We do orthopedic testing to see if you actually have tennis elbow or other things, but we never evaluate people sitting. So since she was sitting, I'm like, oh my God, what if we get shut down again? She's going to be hurting. So I sat her down, and evaluating her standing up, her hips were always very level because she always had a low back pain, like just reoccurring. I sat her down and her hips way off. So I put something under her one butt cheek to lift her up, and she said, "Oh my God, that feels good." So at the same time, I was suffering, which I've never had anything, but lately at that point I was having a hip ache. Couldn't find a perfect stretch. Sitting in the car was the worst. So after I saw her, I had 2 clinics at the time. I got in my car to drive to the other clinic, and I put something under my hip, which I knew was lower. And as soon as I did that, the pain was over 100% instantly. And I was like, what the? So right away, I started researching on this, and I couldn't find anything. So after about 2 weeks, lateral pelvic tilt, yeah, there's a lot of advices on how to fix it, but that's about it. So that's what we're talking about when your hips are off side to side, this in the coronal plane. So I couldn't find anything. So I called an invention place because I was like, nobody's ever done this. We do it all standing. You've heard of a shim in your shoe. Same kind of thing when you have uneven legs or whatever. So I called an invention company. We did a worldwide patent search, and within 10 days, it was funny because I asked the guy, what if they don't find anything similar? And he goes, we always do. And sure enough, there was nothing out there like that in the world. So we went ahead and filed a USA Canada patent for it. It's still patent pending. It's in the works right now, so we've heard a little bit about it, but it's coming. So patent for that and the trademark. So, but I've been doing this for 2 years. I've been shimming people sitting for 2 years now, and it's amazing what I've seen. It doesn't work for everybody, but it's not just about pain anymore. So it sent me on a quest. So I would try it on people. I thought, woohoo, I just invented something for low back pain. But then the more I tried it on people, then, oh, my shoulder feels better. Oh, my foot feels better while you're sitting. Or my headache's going away. What the heck is going on, right? So I look at this up, and it was all about stretching of the spinal cord. That was hard to find, but all these things started to pop up, like Chiari malformation, basilar invagination, intracranial hypertension,
POTS.
oh, all sorts of syrinx, syringomelia, and then hypermobility spectrum started popping up in all of this because your spinal cord can only stretch. You get one length when you're born, and it only likes to stretch no more than about 10%. So if you're sitting like this all day, you're overstretching the tissue. It won't get enough oxygen or blood, and you can actually pull your brain out of your head, like you said. Your brainstem can descend into the bottom hole of the foramen magnum there and do damage to that. And all your cranial nerves come off of it, so which control most of the autonomic functions of your body. So if you have instability up here or a bad posture, you can actually be giving yourself a mild traumatic brain injury on a daily basis. Because if you look up the symptoms, I see people every day, and it's the same thing. They have 10 different things. If they have a lot of chronic neck, I ask them a whole slew of neurological issues if they have them. And even 15-year-olds, headaches, gut problems, ringing in the ears, blurry vision at night when you're tired, constant urination, cold hands or numb hands and feet. What else? Cramping in your legs a lot. There's so many. These are all neurological issues. Acid reflux is probably the number one that I hear. It's so easy to fix. And when you see where the nerves come out in your skull and where they get banged around pretty quickly. So especially the vagus nerve, everybody's talking about the vagus nerve nowadays. Well, the vagus nerve is your rest and digest. So if he's not working good and you're on fight or flight all the time, right? You're like or you can have a lot of anxiety, or a pin can drop and it sets you off. But when you think of the fight or flight, they have to be in balance, or the rest and digest. Now, they each have their purpose. So the fight or flight, he wants you to run away from the lion, right? So he speeds up your heart. He makes your eyes, your pupils, I believe, dilate. I never remember that one. He shuts your guts off. He shuts everything off that you don't need to run from the lion. Your guts is one of them. That's why the other one is called rest and digest. And that's mainly your vagus nerve that does that. And you got one on either side of your neck, right in front of C1. So, and that's where all my research took me.
I was going to ask you about what's happening to cause the acid reflux, because you were saying that's easy to treat. So I'm going to ask you about that.
Okay. So it's not just about when you level your hips, you can actually, because there's only a couple of millimeters between that important nerve and a bone. So if your hips are off, which is your foundation, then your root's probably going to be off. And when you turn your neck or you sit certain ways, you might be actually irritating your vagus nerve. And then all of a sudden you have gut problems along with your neck. So there's so much more to it than just shimming now. That's what I have learned. And I've been working on people now. I've changed my health intake when I talk to people. If they come in with chronic, I already mentioned that, or chronic low back pain, I know they have 1, 2, or 3 of these. They're very associated with urinary problems, gut problems, and reproductive system problems. So if you're having bad menses, or you probably have a little bit of a low back issue, but sometimes you won't have the pain in your back, but you're having these kind of issues and it's still a nerve issue. It's more common than we think. We're just not taught that. It's like our doctors are only focusing on the toaster. The heart is the toaster. You have heart palpitations, but they can't find anything wrong with your heart. Well, they forgot to check the line cord, because that's the first thing you're going to do when you see if the toaster is working. You got to plug it in. But that's not what we're taught. We were all taught the same anatomy, but we weren't taught this way. And with new scanning systems now, they have actually DM X-rays or fluoroscopy that you can bend forward and backward, and they can actually see that your brainstem is descending, or that there's an encroachment, your spine is choking out they can see a bone spur, or they can see that the joints are unstable, and they know that's your problem. And some great doctors, like my fave, Dr. Ross Hauser, who's at Caring Medical in Florida, he puts out the greatest videos. Everybody's got to check him out on YouTube. It makes it so easy to understand. And he has all of his scanning systems. He sees this, and he's fixing so many things through prolotherapy. So he will correct or help correct your spine or whatever, and inject your ligaments to help stiffen them up, to help correct your posture. Because a lot of people have instability. And soon we're going to talk about hypermobility, because those are the people. And it's not just Ehlers-Danlos is the top of the spectrum of hypermobility, but there is a spectrum. And that's what nobody knows about. That is like the biggest thing I've discovered. And half of my clients are hypermobile. How do I know that? Because I stretch everybody in my treatments. You can go to your doctor, they don't know who's hypermobile. Go to your physio, chiro, they don't know. I stretch everybody. So I've always noticed how flexible people were. And when I started seeing all of these things are being associated, from psychological issues to all autonomic function, dysfunction, to mast cell activation, to POTS, standing up and feeling dizzy, that's a huge one. And with my shim, if you are shimmed properly, if that is your problem, I can help you with that. I can diminish those symptoms.
Okay, so what's the definition of a line cord? You've said line cord a few times, but I've never heard that term in my
line cord. It's
training.
my way of trying to simplify stuff. It's your
Oh,
line cord. You have your brain turns into a brainstem, and your spinal cord is what I'm talking about. So think about it. It's all one piece. So it's like a big cable on a balloon, except when you talk of the brain, you forget the brainstem is part of the brain. And the brainstem is huge. Like, why do they always scan you laying down and scan your brain when you have a concussion? They still know nothing about concussions. Why? Because they don't scan the right place. Your brain is really insulated very well. Unless you got a big hole in there, you're probably okay. When you do a whiplash or a concussion, it's the neck that takes the brunt. And what they're finding, these doctors, it's not so rare anymore, that there's so much movement up and down that your brainstem, when you do this too long, you can actually pull your brain out of your head. Some people have no neck issues, they're fine, but some people have instability here, and that is huge. So if you have a lot of headaches and acid reflux and all these things, you don't have 10 different issues, you probably have one. So there's a lot of I follow like Dr. Fraser Henderson. He's the top most published neurosurgeon in North America, probably. And even he's saying, fix the neck, fix everything. So acid reflux. Vagus nerve comes out of both sides in front of C1, a little hole right behind your ear there, along with the jugular vein, which drains 90% of your brain, carotid arteries close to there. You also have a couple of other cranial nerves. So if C1 is off, which a lot of people are, you can actually be irritating those nerves or those structures every time you turn your head or with tight muscles. So vagus nerve on the right, this is my right, goes straight to your digestive system. So I've helped a lot of people just working where he comes out because he gets banged around here. I focus a lot around this area, the lower head and the upper neck. And that's it. If that is their problem, you can damage it anywhere in the body, I guess, because it's a wanderer. It goes right through your body. But on the left side, if you have like a shoulder injury and it's really a neck problem, you might have heart palpitations or because it goes directly to your heart. And a lot of people that have POTS, they really don't know what it is. When you stand up and feel dizzy all of a sudden, there's some that it only happens once in a while, but some people it's like chronic and it's debilitating. It's a missed signal going on because there's too much movement when you stand up. I know this because when I shim people, I've taken people that have POTS without shimming them sitting from a sitting position to standing, and I whip them up. And some people and we sit them back down. I do it under consent and everything. They know what's going on. And then I shim them and then I do it and it's changed. So I don't have any formal research on this, but I am working on it. I've sent this product out to some really good doctors that I follow. So I'm waiting to hear back, but I've seen it with my own eyes and I won't talk about it if I didn't.
And
So
even
acid
like
reflux,
the vagus nerve goes into not just the heart
it
and the
hits
gut,
every
the
organ
kidney,
except for your
yeah, the
adrenal gland.
kidneys and the spleen and the pancreas and like, so
That's
even
right.
diabetic conditions could be this.
Liver. Yeah, well, who
Liver.
controls how much sugar goes into your body? Your liver, right? If you have high blood sugar, you want to treat the symptoms, you're going to go take diabetic medications. But if you really want to fix it, it might be a problem in your neck or in your mid back too, because they have cell bodies, these nerves, and the brains of the parasympathetic, the rest and digestive nervous system are up here and down in the sacrum. But the fight or flight guy, they're all between here and your low back, and they're just on the inside of your vertebrae, each vertebrae. So if you have a problem in your back, you can be irritating. It's hard to explain, but you could be irritating those nerves. So you could be damaging the fight or flight guy too, because they're just on the anterior. And honestly, if I go into your leg and open your leg and find a nerve and pull on it, you're going to feel it all the way up to the top because there's no gaps everywhere. There's a big balloon with the brainstem, and it's all one piece. Below the hole, it turns into your spinal cord. It goes down the middle of your back and splits into two big cables right down to your feet. But then it comes out in between, 31 spaces in between, and it splits up everywhere into your body, right? So if it gets stuck somewhere, especially along the spine, I do a lot of work around the spine, and you bend forward, you could be pulling your brain out of your head more, or it could cause a low back problem. I give people shoulder exercises now to fix their pain in their butt, literal pain in their hip. It's because their problem is up here in the spine.
Now, what's interesting is, so you're mentioning the parasympathetic nervous system, which is, we know, is a division of the whole autonomic nervous system, right? Which also, like you were talking about, heart rate, respiration, digestion, but also blood pressure, because I've had a lot of clients where they are in fine fitness. They are running or working out every day or every other day. They are eating well, they're taking care of their health, right? But their hypertension is out of control and they're not medicated. They don't want to be medicated. Now, I've been able to do certain things with herbs to keep it okay. But think about an athletic person moving around a lot, and maybe had injuries and
That's
pressure there.
exactly.
That makes sense to me.
That's what I would ask them as soon as they come into the clinic here when I treat them. So, like, what are your symptoms? And if that was one of them, I'm sure they have a left-sided neck problem. Rarely you won't feel the neck problem, or it might be in their shoulder, but it's related to nerves, so it's very common. and it would be the left side, because vagus nerve, yeah, like these nerves control the little muscles around your arteries. So if they go into spasm,
And they have
what
branches,
happens?
right? Like, so you have
Yes.
the right and left nerve, but on the left one you have a ganglion, right? And then you
Yeah.
get the pharyngeal branch that goes into the pharyngeal area on the left.
Yeah.
And another branch that comes off, the inferior one, then that splits, that goes to the larynx. So that makes
That's right.
for like stuttering and speech issues, that it would be the left
Yeah.
vagus nerve that's either staccatic, maybe it's not functioning properly, and then the right vagus nerve splits into two branches and goes all over the place. I mean, it's a really cool thing. People really should look at anatomy. They really should study anatomy. Should be
Right. We
required.
were all taught the same. We were all taught the same anatomy, but we weren't taught to think this way. But now, because of scanning, even stand up and sit down MRIs, they can actually see you moving. They could put all the pictures together and see you move in an MRI or a DMX X-ray. That's a game changer. Why aren't they in all of our hospitals? Why can't they see anything? Because they lay people down.
Yeah.
Like, I've seen MRIs where people are all chewed up in their back, 40 years of problems, but they can't see anything compressing, so it's a negative scan. I've seen MRIs like that, but these people have been suffering 40 years. Nothing we can do, it's arthritis. Yeah, there's a lot you can do. I think I can help anybody at least a little bit. I can improve their quality of life at least a little bit. There's nothing you can do.
Yeah.
Some people are more complicated, but now that I think this way, it has opened up so many things. And I have some tricks now. So if you're having a migraine, back your heels up onto an inch sticks of something and see if it goes away. Or I have clients that tell me, you know what's really weird? I can work all day and have no problems, but as soon as I go up the stairs, I'm weirdly out of breath. Okay, well, now I think structure. If you do this, you're pulling your brain out of your head. If you do this, you're giving it slack. So I know most people, when they're scared of going up the stairs, they look down, right? And that's not good, because when you think of the hips and all the nerves, you're pulling. So I want you to give it slack, look straight up when you go, and then the problem goes. I know they have a problem here. It's all structural. And if you have pressure headaches, it's probably fluid flow. There's some great doctors talking about this, but it's not hard. Anybody can do this. If you have pressure headaches and you lay down and it gets better, it's probably fluid flow. And there are some tests you can do. It's just not, most hospitals don't do this. Or if you look up and you feel dizzy, because of all the blood vessels up here, you could be cutting off blood flow to your brain. I've seen that a lot. That's one of my tests. What's another one? I have a few of them now, and I've just come up with them just from doing this over and over. It's so simple to fix a lot of people. Some people are more complicated. Like, do you know what I mean? Like, you see people like that too. They don't just have one symptom, right?
Yeah.
Could
There's
it be they just
complicated.
have, right?
Yeah.
What if it was just one problem? And that's what
Mhm.
I am starting to see after 2 years of testing like this. I've never done this before. I've changed everything. And
Yeah.
it's so common. It's the line cord, the toaster and the line cord. And medicine today, they just want to look at the toaster and find a pill kind of for that. But this has been around for a while now, and these top neuros are saying, I think this is not as rare as we thought, because now we can see a lot more. This and hypermobility. Even somebody with Ehlers-Danlos goes to a doctor and they take 10 years to diagnose them with Ehlers-Danlos. These people can just and pop a shoulder out. They could do this and their finger goes doink, or they can do all those party tricks with their legs or whatever. It's not hard. It's easy to see.
So
But
what's
forget about
happening
Ehlers.
there? Like, what's happening with the hypermobility? Why is it creating that?
It's a connective tissue disorder. So your ligaments and the tissues that hold together your joints are stretchy. And we're kind of like that when we're kids. And as we get older, we stiffen up. But some people don't. And then throw in a few head injuries. It's a connect. So if your joints go past the normal range of motion, so if you're really flexible or you crick and crack, so a lot of people say their knees and ankles, you roll your ankles easy. Some people can really overstretch their skin. Poor wound healing, easy bruising. You could be, some people would just be knees and ankles. Some people it's shoulders and hips. But most, if you have instability in here, and that's why they're associating all of these things
So
to
that means the
hypermobility.
nerve, like the nerve is not feeding the connective tissue appropriately, so
Exactly.
it's sloppy kind of
I
thing.
don't know what causes the connective tissue disorder, why people are hypermobile, but your nerves control everything. Tissue formation, right? They control everything. And vagus nerve will shut off your inflammation response. If you're full of inflammation, why are you full? Yes, you might want to eat better and exercise, but sometimes that doesn't fix it all. So it's like the missing piece of the puzzle. We all need to start looking at this. And that's why I try and teach my clients.
Yeah.
And that's why I want to get this out. 50% of the population, I believe, is on hypermobility spectrum. And the higher you are up, the more health issues you have.
And it doesn't help that so many are on devices with their head down or not
That's killer.
properly. Like I've had to correct my daughter when she's doing work on her computer. We buy all
Right.
kinds of things to lift the computer to eye height. I'm always on her posture. If she's
Yes.
slouching, to pay attention
Another
to
good
that, to
one.
strengthen all the muscles. So
Yes.
this, because that
You,
is an epidemic for sure.
it is. You're actually pulling your brain stem out of your head. And the brain stem's thicker than that hole, and there's a lot of blood vessels there. So if you get a lot of headaches, again, acid reflux, cold hands and feet, all these things, it's probably a neck issue. That's the first thing I think of now. I go to, I see it all the time. Whether you're 15 or, and why are you older people so susceptible to so many issues? When we're young, we're beautiful, we're like this. When we get older, right? And there's really no room for error. So then they start, especially this, and then they have swallowing issues. So let's go back to acid reflux. Vagus nerve controls all your sphincters, your esophageal, your eustachian tube, sphincter, the one in between your, I can't remember what it's called, in between your small intestine and your large intestine.
Pyloric?
Yeah, yes, you have.
A few there.
So anyways, if the signal is not getting through to your esophageal sphincter, it won't close. That's why you have acid reflux.
Yeah.
There's so many, and again, there's a doctor out
There's
there.
the thing is, there's a few causes, obviously. I've had a lot of,
Yeah,
it's a chicken and an egg sort of thing, because you're like, oh, that person is not producing enough stomach acid. I know that they're not. And so I come in and say, here's how you repair your stomach acid by trying to increase the flow, make sure that the tissue integrity is increased. So we add in things to repair the tissue. But if the nerve is not dealt with, which could be even stress induced, right, from the vagus nerve,
yes, absolutely.
then it will continue to be a problem. And that's why stress management is like, you have to have that
Oh, it's
somewhere
huge.
in this picture, right? Because you're just going
It's
to keep
huge.
damaging your nervous system that way.
Absolutely. And when you're not in balance, like how come somebody's house could blow up and they're like chill, and somebody a pin can drop and they go nuts, right? Because you're not in good balance. So because I'm sure you deal with a heck of a lot of stress, and normally you're pretty good with it, and sometimes you get tired and you can't handle it as much. But some people can't handle any stress. They're not in balance. Something's going on. Something is getting damaged. And there's actually some really good. So this is I bought this because the Dr. Hauser. It's a heart rate variability monitor. So you put it on your finger and you download an app. And what it does is it basically tells you your vagal tone. So if you're 70 and above, it means your vagal tone, your vagus nerve is probably working good. And if not, then it's not, and your health is not the greatest. Because if you cut your vagus nerves, you're dead. They've done studies with animals. They cut one and they get in, you cut the second vagus nerve, you can't live without it. So, like, not trying to scare people, but your vagal tone is very important. So you can, and I will use this and make people turn their necks. And some people, they have a big spike with a certain, so I can tell that they have a problem in their neck. I can't see through though. I don't have these scanning systems. Someday I will. That's my plan. But because that's one of my doctors that I do follow. he used to outsource his scanning, but then they would make mistakes all the time. And a lot of the times they don't even look at the upper vertebrae. If you get a neck scan, they're going to start at C3 and go down.
Why?
It doesn't make, right? I
Like,
didn't
that's,
even know they laid people down all the time. It didn't dawn on me until a few years ago. Why would you? These have existed for years. These sit, stand, and I've spoken to an orthopedic surgeon, a local one around here, and I talked to him about why don't we have DMX X-rays in all of our scanning facilities, like hospitals, whatever. Well, we do. I said, what? Because he used to be orthopedic. When they change a hip or do spinal surgery, they have that DMX X-ray so they can see in the body what they're doing. Why are they not in all the diagnostics? When you go get a scan, why don't they do it? They're not high radiation or anything. It's funny, eh? And they have sit-stand MRIs. Why aren't they available?
well, I know why, and I'm sure you know why, because that
There's
industry,
no pills involved.
that's right, and that
That's
industry
right.
is not really about fixing things easy.
No, it's
No.
just amazing. Since I've learned all this, my trust for the medical system has gone way down. So,
Yeah, I
but
bet.
you know what? The good news, if you know, especially girls, when their knees go backwards like that, they sway back. Keep your knees bent at all times. Never do that. You will wreck your knees. When you get older, you'll be the knee replacement person. Plus,
Mm,
when you keep them slightly bent, your knees bent slightly, you keep your muscles engaged and you'll keep your joints stronger. Because a lot of people crick and crack. And then if you crick and crack a lot, it's because you have a loose joint. Your connective tissue is not holding your joint together. So you're the type that's going to have fibromyalgia
mm,
down the road, or you're going to have a knee replacement early on. It's
mm-hmm.
crazy. I
Right.
just want people to know about this. And this product works great too, especially with hypermobile. I find it works the best on hypermobility people.
Can you
You can
show
look
one
at
of
me.
the Butt-thotics? Show one of them.
Sure. This is one with a cover there. It's a shim. So it's 6 millimeters here and it goes down to 2. This is the part that sits on the chair. So you want the thick part at the back and you just put it under your butt cheek. And I used to check people myself, but I got it wrong a lot. It's hard to tell shitting. So now what I do is I just let them try it. And it's amazing. Some of the people, they'll look at me and go, what did you just do? Or I've seen headaches disappear with this shim. But remember, a Chiari malformation diagnosis is your brainstem descends 5 millimeters below the foramen magnum. They consider that a Chiari 1. And this is 6 millimeters. So there's a lot, but for some people it doesn't work. Right? So I know something's going on here. Something is not sitting right. Holy cow, some people's curves, they have a neck curve, should be a nice C. They have a V. Or I felt some that it's like it goes like this all the way up. I know something's wrong in their neck. So
So the shim, can
uh,
you instruct on the way to test it and ensure that you're doing it correctly?
yeah, you just try it. You sit at a chair and make sure it's not too high there. You should be like at a 90 and a 90-degree angle at your hip and your knees. Just try it under half your butt cheek. This works great in the car, office chairs. I got a lot of people doing that. Even kids at school right now, especially during exams, they sit all funky. These work great. So it just lifts your hip a little bit. If you sit in the car and it's uncomfortable a lot, this is probably your problem. So it works great in that and it's simple to use. Where else do I have it? I have prototypes for couches are sinkier, so you don't want to use it in a couch as much. It doesn't work as good. So I have a prototype for that and one for sleeping. I don't know if you ever tried yours. We tried that once. I gave you a little something for laying down when you were sleeping because you know how
Oh
people.
yeah, I think Brandon tried it. I didn't try it. I didn't try it.
Okay.
No, I know I have it. I didn't try it. I think what we were doing is we wanted a cover for it first because it was uncovered
Oh,
and I've cat hair
okay.
and it's just foam.
Oh,
So
I see.
what he
Yeah, yeah.
was doing is he was taking it home to get a cover for it. And so I asked him about where that's at, but so no, I haven't
Oh, that's
tested it.
okay. And that again, it doesn't work, but it's like There's one for sleeping too, because people spend thousands of dollars on pillows and they can never get, and it's never, because it's not your pillow. You know, sometimes we're not looking at the pain is here, but maybe that's not the problem. Do you know what I mean? Like, again, with nerves, it's different. And I've learned a lot more now. I know more than I did before. And I've changed my way of thinking a lot because of this, because this is very, look at today, we're a look down society. We have no idea what's going on in our necks. We need to focus more on that. And like you said, and that's why I came to you to talk about this, because either you can poison your body and your nerves and damage them that way, or you can physically damage them.
Yeah.
And like we said before, it's not a tumor, right? Because they look at all these things, it's always a tumor or infection, right? But yeah, so if you clean up your body, you do a little bit of exercise, and you make sure your neck is okay, especially if you're hypermobile. This is right, not this, this is your apple. Think of an apple core. This is the most important part of your body because it houses your spinal cord, your whole electrical system. And why else? So many people are suffering with no answers. It's so easy.
So what's the
So,
relationship then with the
yeah.
adjustment of the hip? So you're adjusting the hip. How is that affecting the neck? If you want to
Yeah.
explain that.
So if you think of this as your hips, you have the spine, and there's a million nerves, a lot of nerves coming out into your hips. So when you do this, you're actually pulling, and you can feel it all the way up because it's all one piece. That spinal cord is a billion tracts all put together. And when it hits the lower part of your spine, it splits up into hairs and it goes into your hips. So when you're doing this and you're off a lot and you're sitting for a long time, you can actually feel it all the way to your head. That's why when you do that, the headache can go away or all the pain. Also, when you overstretch nerves, they don't get a lot of blood, and over time they can deteriorate. You know, like when you sit for a long time, you get up and you go, oh, and then you walk a little bit and you're fine. That's what you're doing. So by leveling the hips, you're taking the excessive stretch out of there, which will translate all the way up to the top because it's all one piece.
Yeah, and
I
that's
know, I
the
never thought of this before.
that's the cauda equina. It's called the cauda equina, or the horse, the tail of
That's right.
the horse, because it looks like that. Literally looks
That's
like
right.
that. Yeah. And that
And
makes
that's where
sense
you
that if
have,
you're pulling enough, that it will, if you're up here, that it's gonna do this over time and
yes,
damage those fray those nerves and cause,
that's right.
yeah, blood flow issues. On top of it, the way you're sitting is causing blood flow challenges. Not
That's
just the
right.
nerve pulling, you're also not getting blood flow there. And maybe your muscles
Absolutely.
are deteriorating as well. And then because you're not actively performing the muscle, if you don't use it, you lose it, right? And
That's
then
right.
happening there, you just turn into mush.
Yeah. Well, what's happening today? A lot of desk jobs out there. It's great jobs, but they're desk jobs, and you're too busy to go out and exercise and do certain things to counterbalance that. I do have a lot of clients. Those are the ones that seem to do better, and they always feel better when they exercise. But why? Everything's better. When necks are sore, their guts are worse, oftentimes. Or so when they exercise, their guts get better. But it's really common. Like, how many people have gut problems? Obviously,
Oh
it's about
yeah,
how we
and then
eat,
that
but
leads to depression too. Like there's the gut brain connection, then you have
yes,
depression states, anxiety
absolutely.
situations. All of these things are related to what's happening to the nerves themselves. Not like, oh,
That's
there's
right.
something wrong with you that you think this way or feel this way. How do you know that those thoughts and feelings aren't coming because of your physical situation
Dysfunction.
degrading? Dysfunction.
There's dysfunction somewhere. But to properly diagnose somebody, you have to look at the neurology, and it's not that difficult. There are a lot of problems that can happen, but and some people are more complicated, and I would want to send them for a scan because you really got to be careful what you do in their necks or somewhere in their spine too, right? Anywhere in the spine. But it's so much simpler. We have to look at this. And you're the expert at everything body function and clean eating and all that. But see, I didn't know this either, and this is what I do every day. This is all new to me. Well, new 2 years now, but it's amazing. You cannot diagnose stuff without looking at this, especially, and once you do this a few times, you realize, oh my God, I walk down the street, I look at people, I sit somewhere and I talk to somebody, and as soon as they know I'm a massage therapist, I get, though, I have this and this, and I go, oh, you probably have this and this, because I can tell, I can spot hypermobility a mile away now. You always look young and beautiful too. That's the good thing about being hypermobile. People look a lot younger, their skin is nicer, but the problem is you're too stretchy. So, but if you know that, you'll focus on it, you'll stop doing certain things, and it's okay. It's easy to fix or help. And when you fix your leveling, like you can go to the chiro, and they'll adjust you. You're going to go right back. That's
Yeah, and
why a
there's like
shim, it's like permanent.
there's hypermobility due to innervation issues and a degradation of connective tissue. But then you can actually train your body so you can have a healthy body that has proper innervation, and they can be very stretchy, but that's because they've worked their body to create that stretchiness, right? It's not because
Stability.
yes, there's a difference, because people will ask me
Yes.
that sort of things when I talk about it, oh, but isn't it a good thing to be able to stretch or do the splits or whatever? And it's like, well, depends, because it depends on if that's
Depends.
because you're damaged or that's because you have worked your body in a specific way to allow for more elasticity. That's different, right?
That's right. And if you know your hypermobility, like this is what I learned. You have a weak joint, right? Yeah, maybe it's your wrist or your ankle. You roll your ankles a lot, so you damage them quicker, and that's all. Strengthen it up and da da da. But it's not just an ankle thing. Usually, it's on all bones. I see that do the best, that are hypermobile, are the ones that do whatever exercise. Swimming is a great thing, right? A lot of people. There's even a thing called exercise intolerance. Some people have one big day and it takes them 3 days to recover. It has to do with this. And these people are very hypermobile. So, not to knock Ehlers-Danlos. If you have Ehlers-Danlos or you're up there, you suffer, because all of their joints are very stretchy. Blood vessels are connective tissues. They can collapse or they can dilate too much. Everything is very stretchy. They even have a vascular Ehlers-Danlos syndrome. They have like 13 different types, but I really focus on that. But I don't want people to focus on that diagnosis. It's about the spectrum. And once you know that, and you know your shortcomings, you want to get stronger or focus on certain things. Don't do things that don't feel good. They don't feel good for a reason. When you load your joints, don't load a heavy weight down here. Keep your joint bent and keep it closer to you, things like that. Don't keep your knees bent backwards like that. Watch your neck. And an easy way to tell if your palpitations are coming from your neck, let's say you have palpitations, it even controls the AV node, so the rate, the strength of your contractions. He's the guy that's going to calm your heart down after you ran from the line. But if he's not working good, you can get these. But sit up straight. Some people, when they do that, I tell them, or they have this trouble breathing all of a sudden, I tell them to sit up straight, and then the symptom goes away. So you know it's structural.
Yeah.
But overall, we should be looking at the body overall. This is just a new thing. I just happened to discover it because of this. And nobody's ever done this kind of research with somebody sitting in a shim. Like I've done it with like 1,000 people so far. So I've seen the results. It's amazing. Like we've done it. And even there's a controversy with shimming the foot, right? Measure the length of the leg. If the legs are the same length, don't shim. No. Let the person try it, and that's what I do here, and they'll know right away. If you're in pain, if you're not in pain, it's hard to tell. If you have pain, that's when you know. You don't want to shim if you don't need it. So you got to be careful with that. It's up to you to understand this, but it's better when you have pain to try this, but it works great.
So really, it's not just a corrective device, but it's also in a way a diagnostic tool, because you can use it to test what's going on.
That's right, because if they have improvement right away, I know it has something to do with nerve somewhere in the spine. Like even somebody will come in with a shoulder issue. It's my shoulder. I injured my shoulder. Well, I'll sit them on, they do their range of motion where it's painful. I'll sit them on the shim, I'll correct them, and then we do the movement again. And then they look at me and they go, it doesn't hurt anymore, or it's very diminished. So now I really know it's coming from your neck, the nerve thing. So, or I can test. Some people come in presenting for tennis elbow. So I'll do the tennis elbow test and they don't present with it, but they have pain here, but it's not tennis elbow, because sometimes your neck pinch, you can feel it in between your shoulder blades. So you'll work the shoulder blades. That's not where it's coming from. It's coming from your neck. Or it cannot, you won't feel it all the way down. You'll just feel it here. It skips here. So you think it's a muscle thing. No. So all these things, I've even sitting on them, I've seen people with foot pain, it disappear while sitting on that. So, but again, it doesn't work for everybody, but I shim everywhere I go and I don't have that hip ache anymore.
Yeah, and when you're going
It's
to
great.
test yourself, you measure the height when you're standing straight, you measure the height of the top of your ala of your hip, where you would put your
Yes.
hand on your hip,
You could
right?
do it in the mirror and just put your hand on the top of your hips. I find we make mistakes because we can't really see what's going on inside. You might have a smaller hip joint on one side or whatever. I find it's just better to let them sit and try it. And if you ever feel weird things like nausea by using it, or you get a weird headache, discontinue right away. There might be something going on in your spine that's not sitting right. You could have a twisted spine. Because remember, if you're uneven down here, all your spine is going to have to adjust, and one's going to twist, one's going to go like this, so your head can be straight. You have to have a certain gaze angle, or else we'd all be walking around like this, right? But who knows what's going on in your spine? And they even say you're born with one length of spine. When you start over curving, like your mid back and your neck, you're taking more length out, so you're more likely to have that descending brainstem. And then your joints aren't sitting right for a long time, so they will wear out quicker too. Anyways, I just lost my train of thought there.
Well, no, it's good. It's just that, we're trying to help people understand that there is a mechanical, functional, physical misalignment that cannot be discarded when you're considering the whole body just to any chronic complaint or situation. And
The
that
whole body, yes.
yeah, and we're after root cause. We're always looking for root cause, and therefore the physical aspect of the spine and the spinal cord need to be always on your assessment list when you are working, if you're a practitioner working a diagnosis, or especially when you have those cases that just you can't quite put your finger on it. Every time I would, and it's funny, anytime I would have a case like that was just strange, and when you applied your logic and you worked the organ systems and the connections, as I do from traditional Chinese medicine perspective, maybe you'd only get mild improvement of symptoms, that sort of thing. Off to the chiropractor, off to the cranial sacral. I just refer them to body work and body assessments at that point.
That's right.
Yeah, because there's something wrong. Like even I would have cases of asthma. Asthma is not clearing up. We're doing all kinds of stuff with the lungs. There's no changes. Therefore, it's not the lungs, the tissue themselves directly. It's the innervation of C3, 4, and 5.
Oh
right?
my gosh. And the bottom of the brain stem.
Yeah.
So the bottom, like this is your brain stem here. So this is the part, it doesn't belong below that hole in the bottom of your skull. Okay, look at that brain. It turns into this brain stem, 1 billion tracts, and it's got 12 cranial nerves on it, right? So the bottom of this has very important breathing centers, heart centers, nausea centers. So if you have a lot of nausea or you have palpitation, it could be from that. And vagus nerve comes off of him and then comes out here. There's also a lot of blood vessels. And then you're absolutely right. And that's like, I only found this a couple of years ago because I was searching, like, why is somebody's headache disappearing with that? And it is, and then I started looking at people talking about Ehlers-Danlos and their symptoms. And it was like, oh my God, it just all came together. I touch the body too, and I stretch everybody. It just all came together. And yes, So it has to be part of our diagnostics, but doctors don't know that, right? We're all compartmentalized now. So you got a heart specialist, the lung specialist, the gut specialist, and then if they need nerve stuff, they send you off to the neuro, and he does all the same stuff. Don't get me started on that.
Oh,
But,
yeah,
you know,
that might go into a lot of bad language and super swears if we go there.
that's right though. But that's, and I see it all the time. They come in here and they doctor. They
Oh, all
won't
the
even
time.
look at you if you have Ehlers-Danlos and your shoulders pop. 14-year-old here, Marfan syndrome is also a connective tissue disorder. It starts at puberty. He'd been to CHIO, this big children's hospital we have here in Ottawa. He'd been there twice for heart problems because Marfan's often has a heart issue.
Aorta.
He was here for 5 minutes. I talked to him. He'd been to CHIO twice. Wasn't too happy with him. He called me a genius. Like 5 minutes. He's got Marfan. So it starts in your puberty. Those are tall, slim people with tall, long fingers and stuff. The only problem with Marfan's, so you might have a popped in chest or a popped out chest, crowded mouth, scoliosis, flat feet. There's a few physical things that it's obvious. Not everybody looks like Marfan's though. There's some, anyways, but he ended up going back to CHIO and telling him about Marfan's, and they said, no. It's obvious. It's obvious. But I've spoken to Sandy Smenke of the ILC Foundation in Ontario, which is a foundation. They're basically a liaison between chronic sufferers and hospitals because they take so long to diagnose some of these things people suffer. So they have the ILC Foundation that puts on presentations with all these great doctors and always looking for new info. So he told her that I had a talk with her because hospitals know who she is because they don't necessarily like her because she forces them to look at, anyways, or that foundation does. As soon as he said that, the doctor was like, oh, okay, we'll look into it. You know, they dismiss these people so much. They get dismissed, and
Yeah.
I don't even know how some of these people get out of bed. They
Oh,
look
I can
great.
tell you the
They suffer.
dismissal but I can tell you the
Right.
dismissal is their lucky shot because the whatever else they would be doing would be worse, would make it
Oh,
worse.
right. More medication, more, yeah, or cutting
Or
stuff out,
surgeries
or
and
surgery
stupid
for this, or
yeah, yeah. They're eager to cut
yeah,
usually.
I know. So
Yeah.
before you go and get a big heart surgery, because those little muscles around your arteries can go into spasm and give you a heart attack. How does somebody have 4 blocked arteries when they could work, they were fine yesterday, and all of a sudden today they had a major heart attack, 4 blocked, they were collapsed arteries, collapsed.
Yeah.
They weren't. So they go get, I'm not saying getting stents wasn't a good thing, because if there's spasms all the time, you're gonna have a heart attack and die. But the cause was not
Cholesterol. It's not
clogged arteries,
cholesterol.
they were collapsed.
Yeah.
They were collapsed. It happens, but they won't look at that. It's just, but see, by educating people, now people, I've written notes for people and they ask what kind of a specialist I am. I'm just a massage therapist, but they know I know what I'm talking about. Possible neurological issues due to a fall, acid reflux is increased, chest pains coming, trouble breathing, could all be associated. What kind of a specialist is she? Oh, she's a massage therapist. And then they want to just dismiss me, right? But these are very, if you've had a fall or a concussion, you have blurry vision or, sensibility to light, it can all be neurological due to your neck. Look up a mild traumatic brain injury. These are the symptoms that everybody suffers from.
Yeah, I've exposed before, about the lies about cholesterol and what's going on there. And it's hard. Got to consider the statin industry is $1 billion industry, right? They don't want to lose this cash cow. They want you to be scared, to never fix the problem, but to be on medications for life. And statins are a perfect one because also it shortens your lifespan, because actually the people with the highest cholesterol live the longest, and that's according to studies. That's
right. I think I read that on I read one study. That was your podcast I listened to because I know somebody close to me was on them, and I said, if you want diabetes and heart problems, stay on them.
That's right. Yeah.
I had a presentation at a senior center recently, and one of them said, I have diabetes and I have neuropathy. I said, well, sometimes those medications can cause the neuropathy. Because I've looked into that too, and especially if you don't need them, because sometimes they give them for prevention, they can actually cause neuropathy. So, and statins are well known for causing muscle pain.
Yeah.
So if you have a lot of pain and stuff like that, you like really, exactly, they live the longest. People that have your hormones are made of cholesterol, your brain, your tissues are right, or osteoporosis, right? They throw in calcium into your body. Well, if your bones are decalcifying, if movement doesn't do it and exercising, people that have most osteoporosis, guess what? They're hypermobile, connective
Mm.
tissue disorder, bones.
Yeah.
So it's best to exercise. And if you can't, you have a hard time, you got to find a pool. Yes, they're cold. Most people want warm pools. Find a pool and exercise. There's even
Yeah.
physios out there now I've seen that have pools for exercise.
And
Find
yeah,
something like
get
that.
mobile however you can
Mobile.
in some
Yes.
way is important. And
If it
also,
doesn't feel good, don't do it.
mhm,
Also,
yeah, don't, it's not about hurting
listen to your
yourself.
body now. Yes, people got to start listening to their bodies. Really listen.
And also with the cholesterol situation too, right? I was just gonna finish that thought, was when you have the osteoporotic case, right? What's happened is if you get rid of the things in the body that help you deal with what the body is trying to do, which is to clean up an area, fix, repair an area, and it uses inflammatory molecules to bypass tissues that make the areas kind of swollen so that traffic can happen in and out of an area. This is the
Yes.
purpose of
Yes.
inflammation, right? And a communication
Yes.
and all kinds of things. All right. Well, when that happens and you now don't have cholesterol, which is one of your anti-inflammatory agents, you can get
Right.
this runaway inflamed state. You get lactic acid buildup in the body. And because the terrain is now
Oh,
considered more acidic, your calcium is being used as the buffer for the acid and is literally melting your bones into your blood to try desperately to get the pH corrected, right? And this is also where people are like, well, now I'm just going to take calcium. No, because now it isn't going to go back into your bones. That's not the deliverer. K2
that's
is, but still,
you're in the
deal with that.
decalcifying state. That's right.
Yes. So you have,
Exactly.
yeah. People just
It's
don't.
totally,
And this is
you have
this
to
is
change the
simple,
terrain.
but it's this simple biochemistry that any doctor
Yes.
who's gone through any of the training, I've gone through all the same freaking training as them, right? All the ologies. So have you, because we have to.
Yeah.
It's not
It's the
rocket
way we were
science. It's not
taught,
hard.
right?
Yeah.
No. But if you don't think outside of the box, because I've often wondered, why is it that, it's always my left side that hurts, or it's always my right side. Now I kind of know. Why is it when I sit for long and I stand up? It always I'm always thinking, and I couldn't fix everybody. And still there's some people that I can't, but I've gotten even better. I was good at it before, but I'm a lot better now. It's
Well, this is
amazing.
practice.
I would
This is
love to
what,
teach people this.
yeah, this is
That's
what
right.
practice does for us, is over time we learn and we adopt
Mm.
those things, and then we get better as we
And we
go.
listen to people,
And yeah, exactly.
listening to people. We listen really, because they tell you what's going on in a
They
certain
do.
way. They do.
Yeah,
Yeah, it's
absolutely.
amazing. And I love it. It's awesome. That's why we work too hard, eh, Amanda?
Yeah. Yeah, a little too hard.
Good. I
Time
know
for a
sometimes.
vacation soon for me, I think. Well, this has been
Awesome.
great, Linda. Thank you very much for this
Yes.
really important. It's simple in some ways, but complex in other ways. But the
Yes.
goal here is to try to simplify the ideas for people,
Yes.
that they walk away from this discussion understanding the importance of what's going on in their core, and that a
Yes.
lot of their symptoms, sickness, disease states can be that, and to consider it when trying to find answers to why you're feeling the way you're
Yes.
feeling, and that there are resources available. There are now gadgets that Linda's invented. Literally, I mean, that's what we have to do at this stage. we find the answers and we're become inventors of solutions because
I know, it's
the industry
amazing.
doesn't.
Who would have
Yeah.
thought
Yeah.
a little shim like that? And nobody's ever done it. I know, but little simple things like that can
And
change a lot of
prevention.
things for a
And
lot of
that's
people.
real prevention. If you're sitting
Yeah.
long hours, if you're a trucker or you're a commuter, or you sit
Yeah.
at an office desk or you're going to school for long periods of time, this is something. And I like your, I don't think you showed it, but in the pouch that you have, there's an attachment that you can just clip
Oh,
on.
the other one, yeah.
I like that. I like that
Is
because if you're
it, well,
traveling, yeah.
you can clip it onto your pack sack now. You have to put it in your pocket, or if you go to the restaurant or if you go to a show and you're going to sit for 3 hours and I don't go anywhere without it.
Then you don't want to forget it.
Or
It's attached
something.
to you, right? So you're not going to get up and sit up.
Yes.
Yeah.
Especially for kids, or, some people, you can do it to your belt loop and put it in your pocket or in your pack sack at school, because how many kids at school are not comfortable? Yeah.
Yeah.
And and the shim's inside there and it's washable, whatever. It's great. And you get 2 in a box. And they're
That's
not
great.
that expensive. Like, I'm not out there trying to charge people a lot of money. I just want to help. I think this thing will sell itself. It's more about the knowledge that I've learned that I want to share. Because, like, even if that doesn't help you, I'm sure it will. But if that doesn't, there's other things you can do, like watch your neck, don't bend your knees a little bit, watch what you do. If you know about this stuff, it's easy to avoid problems. And 'cause sometimes you're doing things you don't even know are hurting you. You're pulling your
Oh,
brain out of your head by sitting like
oh
this all
yeah.
day.
Oh,
Stop
I
doing
have
it.
I used to always, as a habit, bad habit, every time I'd sit down, I put my right leg underneath myself. I'd curl it under and I'd sit on my leg. So my knee was always like that. And I damaged my knee doing that, where it always had to
Yeah.
click and it felt loose. I created a hypermobility unnaturally
Yes.
on one side of my body doing that. And I had to stop. I had to train myself away from sitting like that. Now, I know you had mentioned something about if you're sitting in a chair that your knees should be 90 degrees. Is that the best for the hips?
That's right. So if you're 5'7" or less, there's probably no chairs out there that really fit you. You're too small for most chairs. You want your hips at a 90. So this is this is a 90-degree angle for your hips and at your knees too. So when you're sitting there, you want your leg to go out like that and your knee to go straight down. If your hip is here and your leg is going down like that, you're actually stretching the spinal cord too much. You want to go straight like that. So put a box or a book under your feet. You'll see that'll make a huge difference right there, especially if you suffer a lot of headaches. How many people suffer headache? It's crazy. So many people. But that can get rid of your headache too, or a shim, or some of your pain. So there's little tricks you can do. If you know about them, it's easy.
Yeah, and then
So
it just
that's
takes
why I've started the
awareness.
channel. Yeah. I've started a couple of channels because I'm going to do some videos about this, and I'm going to share where I get this information. And again, there's a great doctor out there that puts out easy videos about this. So easy to understand. He does 3 webinars though about the vagus nerve. Amazing. So they are 2 hours long, but most of his videos about 15 minutes. I'm going to try and get as good as him, but he has a lot of equipment in it. He's great. He's been doing this for years too. But there's a lot of great doctors out there talking about it. It's just nobody knows about it. Doctors don't know about this.
So where's
But we need to educate them.
Yes, we need to educate the
It's
doctors.
Butt-thotics.com. So it's Butt-thotics, like the Butt-thotics.com
So
is the
3
website,
T's.
and that's where
3
you can
T's.
buy them. We ship them to you. Also, I'm on YouTube now. My channel is, I remember, I got a couple. What's the name, or how do you get on it?
Is it
Post that
Linda
after.
Salter RMT?
That's on Facebook. I don't really talk about stuff on Facebook. The only reason I have a YouTube channel is because a lot of people go on it. But I'm on Telegram too. You'll get a lot more content on Telegram.
It's just
Kind of
your
like you,
name.
because YouTube, you can't talk about everything.
On YouTube, it just comes
YouTube,
up
it's
as your name, yeah.
as my name.
Yeah.
Got it. Oh, okay. Because I thought it was Butt-thotics Learn.
Oh, maybe you have 2. There's just one video there. From 2
Yes,
days
I'm just
ago.
starting
Just
right
your
now.
name, yeah. Okay.
Oh, okay. It's just my name under Linda Salter. Okay. I
Yeah.
thought it was, my handle was Butt-thotics Learn. But I think you probably get through both. Awesome. And then I'm on in Telegram too.
Was
So
that
it's to me.
Butt-thotics? What's the Telegram handle?
It's t.me/butt_thotics_learn.
Okay, got it.
That's how I had to do it.
Excellent. Thank you, Linda. This is great. Good to see you
Yeah.
again. Yeah,
No, you're welcome.
yeah, it was nice
Yes,
to,
we have to try that again too. I have to go on a road trip sometime, but you are busy, so let me know if you're
yeah.
ever open to it.
Well, when it's nice weather and we can sit outside and sip lemonade.
That would be awesome.
Yeah,
Awesome.
awesome. Okay,
Well,
great.
thanks again for this, eh? It's
Yeah,
really nice to chat with you.
yeah, you as well.